Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Let's look at today's top medical news. People at higher genetic risk of obesity requires increased workout intensity study. According to a study conducted at the Vanderbilt University Medical Center and published in the JAMA Network Open, individuals with a higher genetic risk of obesity needs to work out harder than those of moderate or low genetic risk to avoid becoming obese. Individuals with a higher genetic predisposition to obesity may find that they need to put in more efforts during workouts to achieve similar results because genetic factors can influence their metabolism, fat storage, and energy expenditure, making it more challenging to maintain a healthy weight through exercise alone. Physical activity guidelines do not account for individual differences. Genetic background contribute to the amount of physical activity needed to mitigate obesity. The higher the genetic risk, the more steps needed per day, said senior author Douglas Ruderfer, PhD, Associate Professor of Medicine, Division of Genetic Medicine, and Director of the Center at Digital Genomic Medicine at the VUMC. The study included 3,124 middle-aged participants without obesity who owned a Fitbit device and walked an average of 8,326 steps per day for a median of more than 5 years. The data revealed that the incidence of obesity over the study period increased from 13% to 43% in the lowest and the highest polygenic risk score groups. Individuals with a polygenic risk score in the 75th percentile were required to walk an average of 2,280 more steps per day than those in the 50th percentile to have a comparable risk of obesity. People with a baseline BMI of 22, 24, 26, and 28 who were in the 75th percentile of polygenic risk score were required to walk an additional 3,460, 4,430, 5,380, and 6,350 steps per day respectively to have a comparable risk of obesity to persons in the 25th percentile.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
I think it is intuitive that individuals who have a higher genetic risk of obesity might need to have more physical activity to reduce the risk. But what is new and important from this study is that we are able to put a number on the amount of activity needed to reduce the risk, said lead author Iman Britain, MD, Associate Professor of Medicine in the Division of Cardiovascular Medicine at the VUMC and lead investigator in digital health for the All of Us Research Program Data and Research Center. We would like to test whether knowledge of one's genetic risk for obesity actually has an impact on their behavior. I think these findings could be empowering for patients because of the current physical activity guidelines take a one-size-fits-all approach, and what we learn is that depending on a genetic risk, the guidelines may underestimate the amount of activity needed to reduce the risk of obesity. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.